Take a beating when I know what's wrong. You're making me sick. You're making me sick.
Welcome, everybody. Another episode of You Make Me Sick. Today, very special guest, Jon Peltier. Jon, he's a fellow Minifan like I am. He was recently on the Kirk Manahan show, and he had mentioned ketamine. One of the producers of the Kirk Manahan show, Andrew Augustus, had the audacity to take 500 milligrams of THC in one sitting. And Jon was in there while he was actually under the influence of this. And they were kind of bringing up just offhand what other drugs Gus would be willing to take. Jon brought up ketamine, and everybody was kind of taken back by that. Like, ketamine, what the hell? But Jon takes ketamine for depression. So a lot of people probably don't realize that ketamine is actually very potent in treating depression. It's a relatively new treatment for depression. It's only been around, it's been studied since around the year 2000, but only in the last 4 or 5 years has actually been adopted as practice for treating depression. So first, welcome, Jon. How are you?
I'm doing pretty good. Thank you for having me.
Hey, I'm happy to have anybody on, especially to talk about mental health stuff. It's something that doesn't get talked about a lot. And especially, like I said, this is a cutting edge treatment. So hopefully we can this may be, an avenue to help some people who have had a really hard time with depression and who haven't really been able to find decent treatment for it. So like I said, if there's anything that I ask that's too personal, let me know. It takes a lot of guts to come on and kind of just tell people personally about any kind of health issues. So thank you for that. My first question is, how long have you been diagnosed with depression?
I've been diagnosed probably about 25, 30 years ago.
Okay.
Doing kind of a self-diagnostic. I've probably been depressed, all of my life. I remember being like in the 9th grade and, being really depressed. I've never had a suicide attempt. I've never been hospitalized for it. Sorry about that.
I don't know worries.
But I've had suicidal ideations. I've never acted upon them. I could say maybe twice in my life that I went onto the internet and said, looked up what's the best way to go, but never acted upon it.
So with regard to depression, so there's a couple of types of depression. So there's major depressive disorder, and then there's a secondary one called treatment-resistant depression. And usually the treatment-resistant depression, those are people who have the same symptoms as people with the major depressive disorder, but they have far more severe symptoms, they last longer, and can also sometimes bring up a suicidal ideation. Depression, it's very prevalent in our society, especially. I was curious, I was wondering when you were diagnosed too, because you're an older gentleman. How old are you, Jon? If you don't
I'm
mind me asking.
62. Nope, not at
Okay,
all.
yeah. So you've had depression for a while, but even in older adults, adults over the age of 50, about almost 8% report having current depression, and about 15% reported a lifetime diagnosis of depression of that 8%. So even people who are diagnosed later in life have usually had that depression for a long time and just never had it diagnosed. So couple other things related to depression, especially with suicidality. Every year there's almost 50,000 deaths related to suicide and depression, which is pretty crazy. That's about almost 15 people for every 100,000 have either contemplated or tried suicide. And there's about 15 million physician's office every year that are just kind of diagnosed just for depression. So depression, very prevalent in our society. So something that a long time ago wasn't talked about at all. In the last, like I said, maybe 15 to 20 years, people have been really more open about it, which has kind of opened up avenues to try and find new treatments for it too. So prior to the ketamine, did you try any other kind of like pharmacological treatments? Did you try Zoloft or any other SSRIs, anything like that?
You name it, I've been on it. I've tried
And, and
over
anything
40 different meds.
really? All right, yeah. So there's about 10% of Americans actually take antidepressants right now. What's crazy is with antidepressants, they're not effective for everybody. It's only about 40 to 50% of people who actually find some kind of improvement with antidepressant medication, which is pretty crazy when you think about how many people are taking it and how many people actually see results from it. So, how did you find out about ketamine as an option?
Uh, I had seen a doctor for about maybe like 15, 20 years and, tried all these different combinations. And I just basically said nothing's working. I'd have stuff that would work, like Prozac was probably the most effective, but it would wane off, after 6 months, a year.
Mm-hmm.
So I basically gave up. Not sure what the timeline was, but I when TMS, which is transmagnetic cranial stimulation, came along,
Sure.
I tried that, but at the time insurance wasn't covering it. I did like 10 treatments. Then that was the end of my financial situation that I could do it. So it had limited success. I probably needed more treatments. I think I went back to a different psychiatrist, tried some more drug options, same results. I would always pop up, what's the latest in depression meds? So TMS came up, which I tried, and then I looked at ketamine. I was looking at trying to get into studies for different options, but about three and a half years ago, I tried TMS again, and they had I think it was 36 treatments, which was helpful, but after a couple of months, it waned off.
Yeah.
And due to insurance, I couldn't go back in with that. Um, so I, kept on looking. I looked at ketamine about 3 years ago and tried to get in and with insurance, it was like uh, fighting, the hardest battle in my life. So I basically gave up, and then a lot of stuff happened. My parents got sick. I was in the middle of a divorce, or knowing I was going to get divorced.
Yeah.
Issues with the kids, uh, dealing with an alcoholic brother. So it got crazy. So I said I got to do something. Um, and I was with Cigna Insurance, and they had a program that they sent me a letter about, which was like a life coach, but the girl happened to have a psychiatric nursing background. And I talked to her about ketamine, and she said, "Let me look into it." She got me. It's actually not a mental health treatment in insurance. It's the other kind of, a regular insurance.
Just for, yeah,
Medical.
for medical treatment of,
Yeah.
yeah.
So she got me there, and after talking to a couple of people in the insurance company, I finally got someone who said, "All right, let's get started." And I found a program in Dedham, Mass, Dedham Consulting, uh, and the girl there was extremely helpful. And I said, "Look, can you talk to the insurance company? Because if I get in the middle, it's I
That's
don't
usually
know
when it
all
messes
the."
up, right? Yeah.
So that's how I got set up with it, and it, it, I started in, I believe it was January or February of 2022, and it started off. The treatment I'm doing is called Spravato. There are two kinds you can do. You can do Spravato, which is nasal spray.
Hmm.
There's also IV infused. I believe I looked into the IV infused. There was a place in Needham, Mass, but they do not accept insurance, and I think the insurance company doesn't cover IV
Yeah.
infusion.
Are you able to hear me? Sorry, I think my mic is messing up. Can you
Yeah,
hear
I
me
can.
okay? Okay.
Yep, I'm good.
All right. For whatever reason here, sorry. I just want to make sure that I'm able to. All right, there we go. Sorry. Yeah. So, what did you know about ketamine prior to all this? Had you heard about it just as far as being a street drug, or did you have any kind of idea exactly what ketamine did?
Um, Not other than what I had looked up. I never knew it as a street drug, but I had heard of it. Never did it before. I mean, I did take marijuana and do cocaine as a youth. Um, but I never did anything like acid or ketamine like that. So I was basically at wit's end. I just said this to my therapist last week. I said, if I didn't do ketamine, I don't think I'd be standing here today with all the things that were going on in my life.
Yeah, it sounds like you had a lot going on. I'm
Yeah.
glad that you were able to find a treatment that has actually been working for you. So a little bit about ketamine. So it was first created back in the early 60s, so 1962. And it's actually very structurally similar to PCP. So phenylcyclidine, which was initially created as an anesthetic, but PCP is a big street drug, angel dust, whatever you want to call it. But they both kind of work the same way. They work on these neuroreceptors called NMDA receptors. And the way it kind of works is ketamine kind of quiets these receptors, but it also stimulates firing of other neurons in other areas of the brain. And this is kind of how it works on depression. So depending on the dose of ketamine, a lower dose will kind of work to kind of quiet those neuroreceptors, help stimulate other areas in the brain. And there's a thing called neuroplasticity, and this is the brain's ability to kind of create new connections between synapses. And what ketamine has a unique ability to do is it kind of helps create these synapses in the area of the brain that kind of helps, it's the reward center almost. So it makes you feel better. So it's one of these unique things where it's kind of, when you get into the neuroscience of it, seems contradictory because the kind of the NMDA receptors, by quieting those, you wouldn't think that you'd get the kind of antidepressive effects, but it kind of works on multiple systems in the brain to promote that. And that's kind of ketamine is an anesthetic. Excuse me. It's still used today a lot in hospitals. I work in an ICU. We actually use it quite a bit for analgesia, but the doses we use it at are a lot higher. It's like 1 milligram per kilogram of body weight to 1.5 milligrams per kilogram of body weight. Whereas the dose for depression is usually about 0.5 milligram, depending on how you take it. That's IV. Do you know what your dosage is for your intranasal spray?
Uh, I believe it's 83 milligrams.
Okay. Yeah, so different routes. If you were to take it orally, you'd need about 3 times what the IV dose would be because it would have to be metabolized in the liver. You can take it sublingually, so it's almost like a dissolving tablet you can take, or you can take it intranasally. So those require higher doses because it's not, the bioavailability of the actual drug is less than if you get it IV, but it's definitely weight-based, and that's like the therapeutic range. When you do take it, so do you take it at home or do you go into the clinic to have it done? Like, how do you self-administer?
No, you have to go into the clinic. That you cannot pick up the medicine. It gets delivered right to the doctor's office. You have to be there for 2 hours as part of their protocol. They take your blood pressure before, middle, and after because that's one of the side effects, high blood pressure. And how it works, it's a vial. You just it's 3 vials of 27 milligrams, I think, or somewhere in that neighborhood. And every 5 minutes, you do a vial and up each nostril. In how it works, for me, and I guess it's different for everyone. It's just, I would assume, being on an acid trip. You're there for you do the third vial, and like 20 minutes later, you're. It's almost like, for me, looking into my brain. You're
So I
seeing.
was going to ask you. So some of the side effects that people have. So there is the hypertension that you can get. You can get a fast heart rate, which usually subsides about 20 minutes, half an hour after taking it. But then there's these they're called psychomimetic symptoms, and that's kind of like disassociation or hallucinations. It's almost like an out of body experience that you can find.
Yep.
And that's something with typically with lower doses you can get that, and it's almost kind of, it can be kind of euphoric and weird. With the higher doses, if you were to give somebody twice what you're getting right now, you may have those same effects, but you would probably also be, I wouldn't say comatose, but you probably wouldn't be able to move. Your motor function would be less. So that's kind of where there's that fine line of how much to give. But I was going to ask you if you end up with that kind of disassociation, kind of almost out of body experience, looking down on yourself, almost like a dreamlike state.
Yep. Um, and that lasts for about 20 to 30 minutes. And then for another, I'd say 20 to 30 minutes, you have kind of the motor skills are gone, almost like feeling drunk. Like I've gone up and tried to go to the bathroom, and it's like, it's pretty funny. The receptionist is looking at you. I'm sure she's seen it before, but you're kind of stumbling. Um, and then that lasts for about 20, 30 minutes. And then I won't say you feel 100%, but you feel pretty normal.
And
You're not supposed to drive.
yeah,
You're supposed to get a ride there and a ride home.
yeah. Yeah, definitely. Ketamine's interesting because it's one of those drugs that even though you have those side effects, it has a really quick half-life. So which essentially means uh, how long it takes to metabolize the drug, and it's relatively short, which is why you have that kind of quick onset of all those symptoms. Do you ever hallucinate, or is it just kind of the disassociation effect with you?
It's disassociation and just I would say hallucinations. I mean, like I can start thinking of, say, Superman, and I can start seeing Superman in my brain. Or I'll see. But the first time I did it, I was listening to the Kirk Manahan podcast, and it sounded like Kirk Manahan and Blind Mike were legitimately in my head, and one of the doctors next door in the office next door, the door was shut. Both our doors were shut, but I could hear them, and it sounded like Charlie Brown's teacher was wah 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 wah. So the doctor said, maybe you should listen to some like meditation music, and that's and it can vary in effect. I think depending upon what meditation music I'm listening to, or sometimes I'll be on my phone and the writing's like looks like it's an inch. Um, so it's pretty wild. It gets a little scary at times. Some of the stuff you're seeing.
Sure.
I mean, I don't look forward to it, but I don't hate it.
Well, especially if the results are worth, the half an hour, 45 minutes of, that kind of state that you're in. It's probably definitely worth it. And I think I should also bring up, that's why this is done in a clinic. They do have, I guess there are people can take prescriptions at home, but with the same precautions that you have in the clinic. No driving, under supervision. I don't know how often they check their vital signs there, but it's a drug with a pretty good safety profile as far as the side effects from it. But you definitely, because of, as you were just saying, the state that you were in, there's no way you could really do any kind of operating of, especially a motor vehicle, but even walking, you said, was difficult. So
Yeah, and um, as far as whether it's working or not, I mean, uh, Jansen is the company who manufactures it. One of the things they have is it's called Jansen CARE program that I got involved in. So for the medicine, it's only a $10 copay, which is
that's awesome.
for that class of drug that's brand new.
Yep.
I would imagine you'd be paying 60 or more dollars for a copay. As far as depression, I can honestly say that from a financial standpoint, probably cost me my marriage. So if you're looking at it financially, even if you would had to pay out of pocket, and I know it would be difficult for many people, just look at the financial cost that depression has caused someone like myself, or even your whoever has it, yourself who has it, and think about some of the things it's cost you in your life.
Well said, John. I think that's important to think that, the way that depression, can work and affect people, because it can shut you off from all kinds of things. And I mean, the financial aspect as well, like all these things. And I'm sorry that it cost you your marriage too. It sucks. And so,
I'm not saying that's the only thing, but I know it was a big contributing factor.
yeah. So another question I have, I guess, like, so you said you've been doing it since 2022.
Yeah, 24 will be 2 years. Yeah.
Okay, excellent. And do you have your treatments? Is it every week that you go, or is it twice a week?
It started off twice a week for a month, then once a week for a month, then it went to every other week, and then it went to uh, every month. I just dropped down to every third week because I was feeling a little, and it's not, I don't want to tell anyone it's the magical bullet that's, you still have to do the work. I mean,
Well,
I
that's
know if I don't do things like exercise,
yep.
I get down. I'm on my ninth therapist, so I wasn't doing therapy for a long time, probably a couple of years, and I just started maybe like 2 months ago at the suggestion of my girlfriend Joanne. So that's working out
We all
pretty
love
well.
Joanne. Yeah.
Not a big
Thank you,
talker.
Joanne.
Yeah.
Yeah, that's something else I kind of want to bring up is that the medication itself probably it works well in creating those new neuronal synapses and the ability for your brain to kind of almost get that new circuitry. But you also have to do the things to promote that good mental health. These really like kind of antidepressive activities. So exercise is right, a daily routine, try to get sunshine, eating right, even little things like socializing, things that people who have depressive disorders have a hard time doing. Once you kind of your brain, once that reward center starts firing again, you're able to get out there and do those things. It's kind of it's a double-edged sword. I'm going to say double-edged sword. It's more like a two-lane highway. I don't know. I don't have a good analogy for it, but you need to do those things that are good for your mental health while getting the treatment as well, along with having psychotherapy. So seeing somebody and still talking about it. Um, there have been studies that have shown that just if you just have the treatment without these things, the results just aren't as good. So because you're still physiologically having that change, but mentally, if you're not taking advantage of that, you're not going to see the best results you can.
Right. And one of the other things that the insurance company, I don't know if I want to say insisted upon, that I did take it with an antidepressant, which I am. I'm taking generic Prozac.
Yeah,
I consider that one of the best, the most useful drugs that I had taken in the past.
yeah, and I think that's it seems pretty common in like a lot of the kind of literature that I was reading regarding the ketamine with the treatments that they're usually prescribed with another oral antidepressant. So that seems like it's fairly commonplace. So that even though you have the ketamine, you also have that other, whether it's a SSRI or some other antidepressant, to also kind of help bolster uh, in aiding in depression. So
Yeah, I know when I was doing TMS, they wanted to put me on an antidepressant, but I was kind of like, I don't want to because I've done them all, and I don't know if that was my downfall with TMS.
it may have been. I mean, like I said, only about 40 to 50% of people really react or have a some kind of improvement with those antidepressants anyway. And especially if you've been dealing with this for a long time, like who knows how effective they would be with or without.
Right.
So, but yeah, the ketamine seems to work well. It's funny too because beyond depression, ketamine is actually being used in the same similar way with these therapeutic doses to treat obsessive compulsive disorder, anxiety, PTSD, certain substance abuse disorders. They're using it for. They're using it for eating disorders. And they'll also now they're trying to do like palliative care. So oftentimes at end of life, people who are on palliative care or hospice, they'll start them on antidepressants, but antidepressants can take weeks to work. So they're actually starting to kind of initiate ketamine as something at end of life to also give, just as kind of mood enhancer, because it doesn't take as long as these typical antidepressants to start to work. So it's pretty good. It's good for SI, as you said. You had some SI. You never attempted suicide, but that's also something that they've seen improvement with as well as people who have severe SI. The ketamine seems to work really well for them.
Yeah, I know myself when right before I started this, I every 5 minutes I was saying wish I was dead
Ugh.
or I stopped.
Well, I don't think you suck. I think you're great, John. I appreciate you coming on. I want to get to maybe one or two more things here. Have you? So you've been on the Kirk Manahan show a couple of different times. Kirk has been really open about his fight with depression, his suicidal ideation. He's actually been in mental health institutes, and he's kind of gone back and forth. Never really talked about treatment he's had. Have you ever talked to him about ketamine or about him at trying to get ketamine? I don't know if he has ever been even offered the option, but it seems like something that if he's tried everything else might actually work for him.
I did at the John Stewart Memorial. I talked to him a little bit about it and told him, I told him about the hallucinogenic effects, and he didn't seem too keen on them. Um, so, he didn't tell me. Not that even if he did tell me, I wouldn't tell you what
No, yeah,
he
that's in confidence. I appreciate that. Yeah, I should have brought that up before you. You don't have to say it, but I was just wondering if you'd ever mention it to him as far as because of
he did, but he didn't mention anything about his treatment.
yeah. So I just thought that was interesting because it's something that for as like you were saying, it was kind of a last ditch effort for you when you were trying to find help. So um, I think that's about most of the questions that I had for you. I was just kind of curious because it's like I said, this is relatively new. It's something the FDA just approved the esketamine in 2019. I remember I was working as a nurse. I used to work on a burn unit, and we would get patients quite frequently. I would say quite frequently, but once in a while, who would try to kill themselves by self-immolation, so they light themselves on fire. It rarely worked. So you have people who are suicidal, and then they try to kill themselves, and it doesn't work, and now they're usually have to deal with disfigurement and years of surgeries, and they're still depressive. And I remember one of our psychiatrists started trying ketamine on these patients. And I remember one gentleman in particular, it was one of the first cases that I ever saw where they used ketamine for depression. And about a year later, this patient returned and came back to see us, and he was doing so much better. And he no longer had SI and had a new outlook on life. And it was essentially because he was still doing the ketamine, which was this was probably 2017, 2018, so it was still probably relatively experimental at the time. But and that's when I first had heard about it myself. So when you brought it up, I was like, oh wow. So I had to look into it a little bit more and see if it was actually if it had made further advancements. So I'm glad you brought it up.
Yeah, and I asked my doctor how many people he's treated. He said between 20 and 25. He said the success rate is what they claim, about 75%.
Hmm.
Um, he said as far as you know side effects, he said it's strange. Some people just sleep right through it. He said I've had like a 90-pound woman that I thought would be really have hallucinations, out of body experience. No, and then he said I've had these huge guys that are 250 pounds, and they have kind of the experience I have. So
Yeah, everybody reacts differently to it. That's like a lot of drugs.
drugs, yeah.
It's kind of a crapshoot, depending what you take and when you take it and how much of it too. So, and that's the other thing with body weight too. Sometimes you get a person with more body weight, they're going to need a larger dose, and sometimes that larger dose is just enough to push them over the edge. But
Mhm.
I guess yeah, I guess one other thing to mention is kind of more about the receptors that ketamine works on. The NMDA receptors are kind of one of the primary ones. There's other pathways. One is the opioid receptors as well. People are familiar with the opioid crisis and this and that. We have opioid receptors in our brains. They're naturally occurring. Our body makes chemicals that they react to. But it's one of the other ones that ketamine works on. It's why it works really well as an anesthetic and an analgesic, why we can use it for pain. But there were studies that were shown that the NMDA receptors alone aren't responsible for the antidepressive effects, but these opioid receptors as well. And it's still not 100% known completely why this is, but just to bring that up, just as another kind of nerdy thing, another receptor that ketamine works on, the kind of aid in antidepressive behavior, is the opioid receptors as well. But anyway, on that, John, thank you for coming on. I appreciate it. Like I said, it's not easy for people to come on and talk about their personal lives. I know there'll probably only be about 75 people who will watch this anyway, but it's something that I appreciate. Anybody else out there who wants to come on and share their story, I'm always open to talk about whatever. So, John, once again, I appreciate it. I hope that mental health wise, you continue to do great. I'm encouraged that the ketamine's working for you, and just hope that things go well for you in the future.
Okay, thank you. I appreciate it.
Not a problem, John. All right, everybody. Thank you again for tuning in. Like I said, we'll be posting this. This will be on the KMS network on YouTube. And then you can also find it, the You Make Me Sick podcast. That is on iTunes and Spotify, most podcast providers. It'll be up there probably the next day or two. But John, thank you very much again. I appreciate it. Take care, and hopefully I'll talk to you later. All right?
Okay, great.
All
Thanks.
right. Bye.
Bye. Bye.